When you went in and became the CIO of Kaiser Permanente, you redefined that role for them. Can you expand a little bit on that and provide some examples of how your role as a strategic CIO actually really influenced the strategic direction and the competitive advantage of Kaiser?
Well, I joined Kaiser from outside the industry. I didn't know healthcare when I joined the company at all. And so I went in truly as a CIO, looking at the technology challenges of the company. And they were many. And we had a particular commitment to a very major project. An awful lot of money was being spent to get that project done, and we were struggling. We were struggling because the infrastructure wasn't supporting it. The capabilities of the company from a technology standpoint and foundation weren't there, and we needed to make those investments. After getting the board and leadership to agree to the kind of change that had to happen in technology, and after being in the company about a year to 2 years, it became very apparent that healthcare was on the cusp as an industry, and Kaiser particularly was on the cusp of the technology changes that were coming our way. The opportunities that were being given to us by the technology industry were many, and there was no one articulate in the technology possibilities in the future for the firm and what that meant to healthcare. So I ultimately took on the role of translating the technology into the future of healthcare. And by doing that, I became a strategic leader in the company, where I was being asked by leadership, the CEO, and the board to bring forth a vision for the firm entirely, as well as a vision for the future of what healthcare might look like if these changes played out the way I was expecting them to. Once I started doing that, it became an absolute expectation in my role that I would lead strategy and I would lead vision, and I would begin each annual discussion with the board with the art of the possible and what the next decade might look like in healthcare and how Kaiser Permanente should lead the way. That gave me great opportunities to take on a lot more responsibilities, which just came with the territory, and truly influence change both in Kaiser, but then demonstrate in part what the change might look like for healthcare.
So and when you talk about technology within healthcare, and certainly having the title of CIO, I think a lot of people think, oh, payment solutions and, the support that you have for the hospitals for electronic medical records. You're talking the entire expanse of healthcare, right? So personal care, home care, medical devices, pharmaceuticals. Can you describe some of the cutting edge and what you're seeing? Because you actually wrote the book on this, Transforming Healthcare, in 2014.
Well, the way I'll explain it, Kaiser Permanente is a unique institution. It is all of healthcare. It isn't just a physician group or a hospital system or a health insurance plan. It's all of those things. So what it was a great laboratory for the transformations that were coming from technology. When I started thinking about that and putting it together, yes, I had to build and implement the medical record system. And yes, I had to build and implement the core insurance system, insurance management system, or the pharmacy system. In fact, during my tenure, we replaced every system at Kaiser.
Wow.
In addition to that, we invented many things and pioneered many things. Mobile phones, the way we know them, didn't exist when I went to Kaiser. Apple came out with their first product a couple years later. Early on, we used piece of lucite and a camera and movie magic to basically demonstrate to the board our vision of what the future of healthcare might look like.
Oh my goodness.
Ultimately, with that vision, when mobile devices became available, it enabled us to truly demonstrate internally to the system, but then also in home health, what home health might be. We built an innovation center. We actually built a center with a home in it, with a medical center in it, and then laid on top of that many technologies to physically demonstrate how they play out in healthcare, in the healthcare setting or at home. And then we set upon the path of building those capabilities for the first time in an industry that hadn't done that, and then implementing them and putting them in our patients' hands, in our members' hands, in our physicians' and nurses' hands. It was completely the start of a really big wave of change in healthcare. That set of changes is still upon the industry. because the broader industry hasn't embraced it fully. And it's my view that the entire industry has to, in order to really create the kind of better outcome, the best outcomes for patients, but also start to make healthcare, I always use the phrase, to make healthcare delightful.
Right.
And it isn't for most people.
So a couple of questions along those lines. You felt that in order for Kaiser to be innovative, and to develop the cutting edge and be competitive, actually at the forefront, basically leading the industry, you wanted to actually basically build your own lab, right? So your innovation center. Some of the technologies that came out of that, I think one of the ones that you described was a mat that an at-home patient could sit on, and all their vitals would be collected and emailed back, so to speak, or sent back to the doctor at the hospital. And so it was a virtual home visit from the doctor. Is that currently in use with Kaiser? And what were some of the other technologies that came out of your innovation center?
Some of the things we were doing there were probably 10 years in the future. So not all of them were implemented immediately, like this year, next year, the year after.
Yeah.
Many things did get implemented. The ability to integrate a home care setting that allows us to essentially know when patients are not being as mobile as they need to be. For instance, you're sitting on the couch too long.
Right.
And then basically give you a notice that you should get off the couch.
Yeah.
You haven't taken your pills today, so being able to monitor that in real time and understand from a pill dispensing perspective that you always take a particular pill at 9 o'clock, and today it's 11 and you haven't taken it. So the dispensing mechanism in your home actually alerts you should be taking your medicine. A whole host of things, from access to a refrigerator, to sitting too long, to someone might have fallen in their home, and being able to actually have our system get activated to go and deal with a patient fall in the home. So particularly for older patients who might be alone, this kind of safety net was what we were envisioning.
Yeah.
We actually envisioned it going even further from the home into the car, to being able to have a patient walk out of a house, sit in a car, and have a full video interaction with a physician, and at that moment decide if that patient could be handled at home or needed to go to the hospital, and with the vision of autonomous cars, eventually have the car be able to take the patient to the hospital.
Oh, wow.
So we actually were working on that kind of pioneering vision 4 or 5 years ago,
Oh my goodness.
way before people were talking about these things. So the Innovation Center gave us a setting that allowed us to really think out of the box and think about decades into the future and how healthcare might change.
What is personalized health? Because Kaiser kind of defined that 10 years ago. You did, right?
The phrase I used, and I really wanted to define it beyond purely a personal interaction, and I always said healthcare is personal, so therefore it's about you. You start from that position. Healthcare, though, could be real time, particularly today with the type of technologies we all carry with us in our pocket. And I've always said my mobile phone knows me better than anyone. It knows where I am, it typically knows what restaurants I go to, it knows a lot of things about me that have some value in the health system and in my treatment and care. That kind of personalization is truly where healthcare needs to go. But it should be real time. So it actually should be in my life each day and helping me and supporting me to live a healthier life. Beyond that, today we have all the DNA kind of testing and all kinds of views on how DNA and our knowledge of DNA and how it's being advanced can play into this as well. The way we looked at it was, you're with your physician maybe 1% of the year, but you're at home and your eating habits, the groceries you have available to you, the places you live and frequent, just the environment has an effect on your health, much more so than your physician does.
Yeah.
So it's up to a care system to integrate the physician, the support team, and the nurses and others, and that other 99% of your life in a very personal way, but not an obtrusive way, to really enable individuals to care for themselves and improve health and take responsibility for their own health. So personalized healthcare, real-time personalized healthcare is truly about you.